What if Parkinson's disease started warning you years before the tremor, and the signs are so easy to miss that most people never connect them to the brain at all? No tremor, no stiff walk, nothing that looks like Parkinson's. Just chronic constipation that won't resolve, a dream that got a little too physical, the slow disappearance of your favorite smells. I'm Dr. Zaid Fadul, and over the next 10 minutes, I'd like to walk you through the early warning signs of Parkinson's disease, including the ones that can appear a full decade or two before anyone gets diagnosed. If you're between 35 and 60, if you've had a parent or loved one go through this, or if something has felt off and you can't explain why, this video is made for you. And stick around, because sign number 3 on this list is one that almost nobody talks about, but the research behind it is staggering. Okay, let's dive in. Let's start with the big picture. What does early Parkinson's actually look like? Most people picture an elderly person with a trembling hand and frozen facial expression. Think Muhammad Ali in his later years. The slowed movement, the masked face, the visible tremor. We all have that image, but here's what most people don't realize. Ali's speech had already started slurring by the time he was 36, a full 6 years before his diagnosis. Nobody connected the dots until it was obvious. That pattern, symptoms hiding in plain sight for years, is the rule with Parkinson's, not the exception. Parkinson's disease is a multi-system disorder with a silent buildup period, a prodromal phase, that can stretch 10 to 20 years before the first movement problems appear. During that window, the disease is quietly damaging nerves in the brain, the gut, and the autonomic nervous system. So what are the early signs of Parkinson's disease that show up during this silent phase? Chronic constipation, a fading sense of smell, vivid physical dreams, depression or anxiety that seems disconnected from your circumstances, and unexplained fatigue. None of those sound like Parkinson's. That's exactly the problem, and it's why diagnosis is delayed by years, especially in younger patients. Some of those symptoms sound like just getting older, right? So how do you know when it's more than that? Let's break it down. This is one of the most common questions people search, and it's a fair one. Here's a clinical difference. Normal aging is gradual, stable, and symmetrical. Parkinson's is progressive, and it almost always starts on one side. Occasional constipation, normal. Chronic constipation lasting years, paired with sleep changes and mood shifts, that deserves attention. Forgetting a name now and then, it's normal aging. Losing your sense of smell completely with no cold, no allergies, no explanation, that's a red flag for Parkinson's disease. The challenge is that many people now blame a lost sense of smell on COVID, when it could be an early warning sign of something deeper. Feeling stiff after sitting too long? It's probably aging. But if one arm stops swinging when you walk, or your handwriting is getting smaller and more cramped, those are specific neurological signs called rigidity and micrographia. Any one of these alone might not mean much, but when these symptoms combine, your risk goes through the roof. One specific combination of 3 symptoms has been shown to increase Parkinson's risk by 23 times. Let me show you the data. These are the 3 most common validated warning signs in all of Parkinson's research, and most people have never heard of them. Number 1 is REM sleep behavior disorder. During normal sleep, your muscles are temporarily paralyzed. It stops you from acting out your dreams. In REM sleep behavior disorder, or RBD, that safety mechanism fails. People punch, they kick, they yell, and they fall out of bed while fully asleep. Here's the data. More than 90% of people with confirmed RBD eventually develop a synucleinopathy, most commonly Parkinson's disease or Lewy body dementia. That silent period can exceed 10 years, one of the strongest predictive markers in all of neurology. Number 2, loss of smell. It's called hyposmia, and it can appear 5 to 20 years before any motor symptoms. A protein called alpha-synuclein builds up early in the disease, and one of the first areas it damages is the olfactory system, the region that controls your sense of smell. Now, here's something important. After COVID, millions of people lost their sense of smell. Most got it back, but some didn't. What concerns me as a physician is that people are now more likely to blame fading smell on long COVID and never think twice about it, even though the most recent variations of COVID don't affect your sense of smell. The Michael J. Fox Foundation has pointed out that smell loss with no known cause is specifically linked to higher Parkinson's risk. So if your sense of smell never fully returned and COVID doesn't fully explain it, bring that to your doctor. Number 3, chronic constipation. Growing evidence suggests Parkinson's pathology may actually begin in the gut. The same protein buildup that damages the brain also affects the nerves of the digestive tract. Data shows constipation can appear up to 10 to 20 years before diagnosis. And there's emerging research on how the gut microbiome itself may play a direct role. I made a full video breaking down the gut-brain connection in Parkinson's disease, so check that out if you want the deep dive. Here's a finding that ties it all together. In a large prospective study of over 6,000 men, the combination of all 3, RBD, loss of smell, and constipation, carried a 23-fold higher risk of receiving a Parkinson's diagnosis within 3 years. No single symptom comes close. Those are the hidden signs. But what about the ones you can see? The 5 motor symptoms of Parkinson's have their own early clues, and one of them might surprise you. The classic Parkinson's tremor is a resting tremor. It shows up when your hand is relaxed, not when you're using it. It often looks like a slow pill rolling motion between the thumb and fingers. That's why doctors call it a pill rolling tremor. And it almost always starts on just one side. But here's the thing, about 20% of Parkinson's patients don't even have a tremor when they're first diagnosed. So don't assume you're in the clear just because your hands are steady. Number 2, bradykinesia. That's just a medical word for slowness. Things that used to be automatic start feeling like a chore. Buttoning a shirt, typing, getting out of a chair. Number 3 is rigidity, which is persistent stiffness in the arms or legs that doesn't go away. One early giveaway, reduced arm swing on one side when you're walking. Number 4 is micrographia. Your handwriting gets progressively smaller and more cramped over time. And number 5, hypophonia. Your voice gets quieter and people keep asking you to speak up. Remember, that's exactly what researchers found in Muhammad Ali's archive footage years before anyone suspected Parkinson's. Each one on its own is subtle, but stack them together and they paint a very clear neurologic picture. Now, if you're in your 30s or 40s, you might think this doesn't apply to you, but young-onset Parkinson's is more common than most people realize, and it looks different. Young-onset Parkinson's disease, diagnosed before age 50, makes up a significant portion of all cases, and it often doesn't look like the textbook version. Think about Michael J. Fox. He was 29 years old, filming a movie in 1991 when he noticed a tremor in his left pinky. He thought it was a hangover. It wasn't. That tiny tremor was the first sign of young-onset Parkinson's, and it would be 7 years before he told the public. But Fox's presentation is just one way it shows up. In many younger patients, the most common early motor sign isn't a tremor at all. It's dystonia, sustained muscle contractions that cause cramping or abnormal postures, especially in the feet and legs. This gets diagnosed as a sports injury or orthopedic problem, sometimes for years. Depression and anxiety are also more prominent in younger patients. Not situational sadness, but persistent mood changes disconnected from life events, reflecting declining dopamine activity well before movement symptoms surface. At Bespoke Concierge MD, we work with patients in exactly this age range on comprehensive neurologic and metabolic evaluations. So at what point should you actually talk to a doctor? Here's my clinical guidance, and it's more specific than what you'll hear from most sources. If you have one of these signs on its own, mention it at your next checkup, but don't panic. Many have other explanations. If you have 2 or more, especially if they've been progressing over 6 months or longer, that warrants evaluation by a neurologist, ideally a movement disorder specialist. What should that workup include? A thorough neurological exam, potentially a DAT SPECT scan, a specialized imaging test that measures dopamine system function with over 90% sensitivity and specificity, even before obvious motor symptoms appear. And increasingly, an alpha-synuclein seed amplification assay, a next-generation test that can detect the hallmark protein of Parkinson's in blood or spinal fluid up to 10 years before clinical diagnosis. If you understand the full diagnostic process, I break it all down in my video on how Parkinson's is actually diagnosed. I'll link that above. Early detection isn't just peace of mind. It opens the door to neuroprotective strategies and lifestyle interventions that work best when started early. Research shows that lifestyle measures, especially regular aerobic exercise and a Mediterranean-style diet, have been associated with up to 60% reduction in Parkinson's risk. I go deep on exactly what those preventive lifestyle practices look like in a dedicated video. I'll link that one here too. At Bespoke Concierge MD, advanced biomarker testing and early screening protocols like these are part of what we do. We don't wait for disease to become obvious, we look for it while there's still time to act. Here's a reality. A standard 15-minute doctor visit isn't built to catch a disease that hides for a decade. These dots take time and expertise to connect. That's why I built Bespoke Concierge MD, to practice the kind of proactive, personalized medicine that can actually catch what conventional care misses. Whether it's gut health optimization, sleep evaluations, advanced biomarker panels, or building a personalized longevity strategy, we give you real time with your physician and a plan built around your risk profile. Early detection changes outcomes, and you deserve a doctor who treats it that way. If you want to go deeper on this topic, check out our other videos and interviews so you can stay informed and ahead. If you're concerned about Parkinson's disease or want a roadmap for how to prevent it, the video on the right is an overview of lifestyle practices that can help prevent Parkinson's disease from developing in the first place. The playlist on the left covers Parkinson's disease topics in detail, like prevention, treatment, and where the science is going. And hit subscribe. I publish evidence-based medical content every week that could change your life. See you in the next video.